happy to be in front of you to go through your 2020 election process and just kind of make sure that you understand how to navigate health care, not just health insurance. I always tell people that health insurance is just a funding mechanism to pay for health care, but knowing how to navigate the system, which has gotten kind of complicated, is actually just as important, right? Because we really want to get through to you today by using this new guide as kind of your piece to take home and use and write all over and share with a spouse. How great your benefits really are here, and how to navigate the system itself. So that's what we're going to go through today. We're going to fly through a bunch. It's going to be like drinking out of a fire hose, to be honest. We do not expect you to retain. There's no test on all of it. If you retain some of it, that make me feel better. But we're really going to go through a lot today, and our goal is that you come out of here feeling like you know how to navigate healthcare a little better. So we're going to hop right into this. So this is your open enrollment period to make changes to your benefits without a qualifying event. Because your benefits are on a pre-tax basis for the most part, once you set those benefits and the way the carriers write them is that if you were going to make a change to those benefits throughout the year after this open enrollment period, this week and the next, you would have to have a qualifying event. So things like marriage, birth of a child, right? Some of you don't want any more of those, so you don't want to have to do that just to make sure you can change your benefits in the future. So we're going to go through this. That's ultimately what page 2 is saying in here, okay? And so I'm not going to make you read all of that. I am going to have you turn to page 3 because page 3 is really important. Other than this guide being new to Jackson County this year, we also built an electronic library of all things Jackson County that's at your fingertips. So if you go out to this website, employeenavigator.com with the benefits, and then type that in, and you use this username and password, you will have access to all things quartz insurance, all things related to the Allstate and the dental and all that. You have the ability to go get any form really you want versus having to contact HR, wait for HR to get back to you, make sure you have the right forms. Of course, you can do that process or contact our team on occasion, but we wanted to make sure that you really have the ability to do so. And if there's greater detail you want to know about specific benefits, those details will be out there available to you too, okay? So know that's happening and out there for you to go out and search. Page 4 is going to be your table of contents to what we're going to go through today. So we decided to put together basically a checklist here of who the carriers are, who contributes to them, and are they on a pre-tax or post-tax basis. You'll see that all of your benefits in effect are pre-tax because Jackson County does contribute to just about all of them other than the flex spending account, which is your dollars to spend on medical, dental, and vision expenses, pre-tax. So we are going to go through these benefits today, and we're going to talk a little bit about how to use health care throughout. So let's hop right into that. Page 5. Page 5 is the plan designs available to you at Jackson County for 2020. The good news for a lot of you in this room is that nothing's changing on the plan designs, okay? And these plans are the contract that we are buying from Jackson County, but it isn't all your responsibility to hit these deductibles and co-insurance. So let me explain how we do that here. So when we contract with the courts as a county, our goal is to pay the least amount of premium possible up front, right? And we can do so by buying higher deductible and higher out-of-pocket contracts, because no one really wants to have this high of out-of-pockets, right? And then why we do that is because we know actuarially that if I were to look at this whole room, that a majority of you are not going to hit a $5,000 deductible in a given year, right? Matter of fact, a lot of you, 4 out of 5, won't hit that amount. So we feel comfortable buying a higher deductible contract from courts and then redesigning it ourselves as the county. So I'm going to have you turn right now to page 13. Page 13 is going to be the page you're going to want to flag, which is ultimately how your plan works, using a picture. I'm a visual learner myself, so that's why I do this. This is really the page that you are going to want to share with your spouse and understand on healthcare and maybe write on, okay? So what this shows on the right is an individual, or excuse me, on the left, if I'm looking at you, on the left, and on the right, a family. Okay? How this plan works is we're going to break up that deductible and that out-of-pocket by using Jackson County's money, just like we always have for those that have used it. So you're responsible for the first $1,000 of that $5,000 deductible. That is your deductible. If and when you hit $1,000, Jackson County is going to kick in and contribute 100% on the next 4. Okay? So they're paying you to pay courts the bill when the bills are due. Okay? And so what happens then is the remaining portion, once that deductible is hit, is the co-insurance. That's what you are co-insuring with courts after your deductible. You're at most at risk there for $500 additional. So said differently, your out-of-pocket maximum on this plan is $5,500, but Jackson County is paying $4,400 of it. So at the bottom, if you were to kind of circle a number, in your worst case plan, you're as an individual on the plan, the most you could ever pay is $1,500. That's a fairly low out-of-pocket maximum going into 2020. Okay? We insure about 800 groups at the insurance center. I can tell you in the top 3 of plan designs out there. Okay? That's how rich your benefits are. Okay? Now, if you have a family plan where you have spouses and kids on the plan as well, we have what's considered an inductible or embedded deductible, and what that means is that we track individuals inside the family just like we track an individual here. So you'll see on here it says $1,000 per individual, or first $2,000 per family. What we do there, and the way the design of the health reimbursement arrangement is that if you get there with one person, you start to get help right away once they hit $1,000. Okay, and so yes, you have to have 2 people inside a family ultimately have claims before you could ever get to an out-of-pocket maximum of $3,000. You cannot get to an out-of-pocket maximum of $3,000 with only one person in the family having claims. Okay, so if it's always your spouse that's doing it, right, you have a cushion there, so you don't have to blame them as much. So that's how the plan works. It's how the plan has worked in the past, right? This plan, to get that money, right, is administered, and we have a third-party administrator that handles that plan. And you know, for some of you that have done this and had $1,000 in claims, we use EBC out of Madison, or Employee Benefits Corporation, to get those dollars sent to you. Okay, and so you're going to want to make sure that you are part of that process to get access to Jackson County's money. How many here, just really quickly, show of hands, have done that process in the past? Okay, good. All right. For those of you, just as a reminder, in that process, you have 60 days after the plan year to do so. So really by March 1st of 2020, you're going to want to make sure you have your 2019 claims cleaned up. Okay. And
See, there's a problem with some of that, because some of the local hospitals are really slow at billing.
some of them are a little slow at billing. Yep.
Yeah, you gotta kind of write them.
You got to ride them a little bit when that happens. Yeah. That is reality. If you have claims that happen in December at the end, you only got a couple months to process them, right? That's one of the issues that you're going to have to just acknowledge that. Feel free to ride them and tell them that they have to get processed through your employer who shares in that contribution with you. Okay. So that's how the deductible and coinsurance work. Can I have you turn back to the health plan page on page 5 again? You'll see there are 3 plans on here. Okay, the blue plan is the HMO plan, right? That's only in network. There is no out of network benefit, right? If you're going to have care done, you must go in network, or insurance does not cover it. Almost all of you are on that plan because of the price point on which it is. Okay. Now, when I say that, I mean that you have to do it in network unless it's an emergency. Emergency is always covered no matter where in the world as in network. Okay? I do not want you to be like the person I had last year that called me during a heart attack in Montana and asked where they should go. Okay? Don't do that. Go get care wherever you're at, all right? And it'll be covered as in network by the plan. This is a tough crowd. You guys don't laugh at anything I'm saying so far. Okay? Actually, it wasn't funny when he called me, but he was having a heart attack. And you don't have to worry about that. If you're in Mexico, if you're wherever you're at, it'll always be covered in network until you're no longer considered an emergent state. The reason why there's a point of service plan and also a PPO plan is to add out of network coverage. If you absolutely want a doctor at Mayo for something, okay? We're not saying that you can't at Jackson County. What we're saying is that in network with Quartz, Mayo is not covered. Okay? So if you're going to want access to Mayo, you would have to have the point of service plan, which costs more, and Mayo would count as out of network in terms of their cost. Jackson County is only helping you up to that page 13 contribution amount. So if you take that plan, you would have additional cost. That said, if you did all of your doctoring at Gunderson, but you feel really comfortable, or Black River Falls, or any of the other contracted hospital systems that are with Quartz, and you wanted to still have access to Mayo or others, all of your in-network claims do apply to the out-of-network benefit. Okay, so I'm going to give you myself as an example. I've been through cancer, okay? At age 21, I went through 7 months of chemo. It was a $600,000 medical bill. At that time, my cancer and all my treatment was done at Gunderson. I also ended up having my port line, where they put the chemo in, dip too far into my heart and cause a blood clot on a valve, which meant I had to go see cardiology at the same time. Well, depending on, let's say I really wanted to go see a cardiologist at Mayo. If I had done all my doctoring at Gunderson, I would have at least gotten credit for my in-network stuff to my out-of-network, out-of-pocket, and I only would have paid the difference at Mayo if that were the case. Now, that is a pretty dramatic situation when that happens, but every once in a while, we have people, right, that want to have other places to access, possibly in case something major happened than just what Quartz's network might be. That is why we offer that plan, okay? And lastly, the PPO plan is really meant for those that live outside of the Quartz footprint, all right? And what I'll hit on with that real quick is, this is in your guide. We have these available. It's on the electronic library. But Quartz's footprint really, inside this whole white space on the screen and all these dots that you can barely see from where you're sitting, you have a very large network with Quartz, right? So it's not just Gunderson, it's not just Black River Falls. If you wanted to go and see a specialist in Madison at UW Health, you can, covered as in network on the blue plan, okay? The only reason you'd be on this PPO plan is if you're really living outside of this. And here's the goofy part about this is why healthcare is so confusing. Gunderson's not even a network on that green plan. So the Quartz sells it, but they're not a network on it, and so I don't even want to confuse you with it. So unless you're that person, see me after, but otherwise you're really kind of focusing on these two, and I would bet 98% of you are focusing on the blue plan once you see the rates. Okay? But let's talk about this a little bit further. The reason why it's important to know this and then also know how to search the directory for where you can access is in the event you're ever someone like me that hears the unfortunate news when you didn't expect it that, hey, cancer's going on. Now, I trusted my Gunderson doctors, but in the ability that I wanted to have a second opinion, second opinions are good when you hear those words, by the way, I could go to the UW Carbone Center for Cancer in Madison, have a second opinion, it's going to be covered by my insurance, and see some of the best cancer doctors there. Okay, let me give you a less dramatic reason to know that. Let's say you have a 15-year-old daughter who really wants to get into dermatology, and it's a 3-month wait to get in. Nothing is saying you can't go to other places to get her in sooner, or sooner. I should just blame it on girls, right? But if you all of a sudden you go, hey, I can actually get into dermatology at Winona Health, okay, or behavioral health at Winona Health within 2 weeks, you can. But a lot of us, right, some of you are shaking your head, you think of maybe 1 or 2 hospital systems as your network, and you really have a more expansive network. Any questions with that? Yes?
Can you be referred to somewhere else? What that does by your doctor?
Can you be referred to somewhere
covered?
else? So here's kind of the line on how that works within the Quartz system and the Gunderson system. They really have to be unable to provide the service for them to refer you out. On occasion, there are rare diseases that they will do that, right? Where they could refer to Rochester, Mayo, or someplace else. But a lot of time, they are going to refer you probably to UW Health in Madison to start with.
Right.
But I've seen it. I've worked with people that have had some rare cancers and some other things where they do that. in your guide on page 9 and 10, we did include how to search the network. So there's 2 pages in here. We gave you some, basically all the steps to help you search the network. I wish it were just easier, but if you go to Quartz's website, okay, and you hit find a doctor literally at the top of the screen, you can dive into different doctors or facilities you want to search within, or you could dive into by location, by name, by gender, by language, by specialty, and you could know really quickly who's in network within your plan by just using this tool. Okay? Of course, I'm going to tell you, as soon as we printed this, they came out with the fact that they're combining the network name you have to look up by. Right now there's a couple options on there. It's all turning into one name called commercial, PPO. If you see that out there, that's the one you click on. Okay, so if you want to write that down next to step 3, you'll be able now to search and filter any doctor or facility in network. If you do not like this step and you want to call and be on the phone with customer service with Quartz, feel free, they can also walk you through that too. Okay. Does that help that you just to know you have some other options available, okay, as in network? The other thing that we added to your plan this year is a dependent care rider. If you got dependents that are not living inside this footprint, say it's a kid away at college or a child living with a parent someplace else for a certain amount of times, if they're gone for more than 3 months and living outside your residence someplace else, like kids at college, if you let Quartz know about that, they can flag that dependent on their account, and they could be seen now in the city that they're in for even some primary care. So if you're part of that population and want a little bit more about the dependent care rider, see us after or talk to Susie or Kyle, and we can kind of help you out with that step. Before, like when I was in college, right, and some of you others that have had kids, you'd have to wait till like the holidays and come home and do all your doctoring during a very specific amount of time. Quartz has added now a rider this year where they can start to do some of that where they're at, as in-network coverage. Okay. All right. So those are a couple things that I wanted to point out about just network and the out-of-pocket costs. If we go back to page 5, you're lucky it's country. If it wasn't country, you'd have to throw $1. Okay. All right, so page 5, just a few other things about your plan. You know that office visits, specialty visits, emergency room all go towards your deductible and co-insurance. You pay the cost of what those are, and so we're going to talk why that's important to know how to navigate the system. But then also prescription drugs, you know that you have co-pays on those. So we're going to hit on these last 2 things about the health plan here right away. On the back counter back there before you leave, so we have this new updated Gunderson Care Your Way roadmap on how to navigate the care available to you. And why I show you this, what's interesting is that you really have a lot of different options on where to seek care when it's appropriate versus where not to seek care when it's inappropriate and have higher costs. On your plan, the fact that you're going to pay 20% of a specialty visit or emergency room visit or urgent care visit means 20% of a $1,000 ER visit is $200, which is pretty pricey. And we know that about 30% of ER visits are unnecessary. Matter of fact, they should have been done someplace else. They weren't true emergencies. I don't want to have you have some of that sunk cost that you don't need to. So basically what this roadmap does, and Gunderson came out with this just this recent past month, is they say, hey, we have a free option all the way up to emergency room, but you're going to be paying in that. We only really want to see you here as if it's truly an emergency. They say 500 with a plus sign. ITs should have like 3 plus signs on that. Okay, those are emergencies truly. Then there's urgent care, which is probably 164 up to like 250 if it's an urgent care visit. But did you know there's really actually 5 options that your insurance covers before that? And there's actually 1 option with cash clinics that it also works for a lot of people to go to. So that's what I want to focus on right now. You have a free option to call the nurse hotline with Gunderson, okay? If it could be something small and talk about it over the phone with a nurse, that's about all that's good for. A lot of times they're gonna have you come in or refer you to something else if they can't handle that call. Then, if you wanted to talk to a doctor and connect on things like back pain, some more common ailments, if you went into the My Care portal, Gunderson's online portal, you had a $40 option to do that. Okay, most of us haven't done that. A few of you probably have and figured out how to do that. But the new option starting January 1st that some of you have heard on the radio or starting to hear out there that Gunderson's promoting is their new $49 virtual visit option. So January 1st, what's happening, and we included this flyer in your packet because I think it's a good thing. At least I believe I did. Pages are all sticking together. Page 8. Okay. Page 8 allows you from the comfort of your home, or the cab of your truck, or wherever the heck you are, to not have to go in to see a doctor or talk to a doctor to take care of the thing you have going on. Okay, so a lot of us aren't huge proponents or haven't migrated yet to telemedicine and virtual visits. I'm going to challenge you to think differently about this moving forward. If you can talk to a Gunderson doctor over the phone about your common ailment you have, or you can even get face-to-face with them through your camera, and they can see the thing that's going on, and it's $49 only versus you paying your deductible plus co-insurance for an office visit that's probably closer to $130. And then you don't have to go in the winter in the dark when the roads are bad with other sick people in the waiting room. It's a pretty good option. Or if you're like me and every once in a while you have a screaming kid in the middle of the night and you just really don't want to go in because kids don't get sick at noon, right? They don't get sick at midnight. Virtual care options are really nice. Okay. You can download their app. That logo is now available where you can download it on your phone. In the event that you don't want to take time off of work, or you have something that pretty much you have an idea of what it is and a prescription will clear it up, or you just want to talk through to verify what it is, you can do so now with these doctors and have it taken care of right then and there. For $49, and it'll apply towards your out-of-pocket maximum. So those that use this once are 75% more likely to actually reuse it every time for some of their primary care needs. Has anyone used telemedicine? Just out of curiosity in here? That's why I'm spending this much time on it. Okay, I'll explain myself how I use it. I used it a week and a half ago. Kind of embarrassing. My body doesn't always react the way I want it to. But when the cold hits, like it did actually the first morning that I did Jackson County meetings, and the highway department was not here for them, okay? It got really cold, my body freaks out because I also have to do 90 of these meetings in 30 days, which means I'm also stressed this time of year. So I get a cold sore every once in a while when my body freaks out. I know a cold sore basically needs just a 2-day prescription to clear it up and be done with. And I don't want to deal with it. So I hopped on this, right? Talked to a doctor so I could get a prescription sent to my pharmacy of choice within 5 minutes. Went and got it, missed no time, took care of everything. I'm very comfortable paying $49 that applies to my deductible, and I can use my flex spending account to pay for it as an option. So if it's things like pink eye, or it's things like rash, or if it's sore throats and you pretty much know what it is, okay, this is a pretty good option for you to use virtual visit and go that route. I challenge you to use it. The other reason I challenge you to use it, Monroe County and you share in the costs when you guys doctor. Or Jackson, excuse me. Monroe's later today for me. Jackson County and you share in it, and what I want to make sure is that when you're going out and doing care that you're not spending excessive dollars, because your premiums that you all have already looked at inside here are based on your medical use as a group, right? So when we fight really hard on negotiating your premiums with courts, right? And this year we did have a percentage of increase of about 9%. Okay, the less we spend, the less the premiums go up for you. So if we doctor smart together, that's what will happen. So our trend will stay lower. Okay, so using it, try it. It's a really nice option. Then there's Express Care. So previously it's been Express Care is $65. Don't need an appointment. You could go to the Festival of Foods in La Crosse in Alaska. It sounds like, according to Kyle, Black River Falls Hospital just made an announcement they're going to add Express Care to their hospital system. So you're gonna have a new option here to be able to do that. So you can go in without an appointment, but it's not gonna be coded as an urgent care visit and be that cost. Okay, so that'll be new to you. And then and only then does an appointment with a doctor maybe make sense, where if you really gotta be seeing face to face or that's what you're comfortable with, then you can go that route. So you really have a lot of options here to navigate where insurance can be used to help pay for it, is my point. Okay? Now, there's another option that I think is really important you be aware of, and if you can go to page 12 really quick, I want to talk to you a little bit about cash clinics. Okay? And of course, after we made you this clean, beautiful guide, we also found out that there's one here in Black River Falls, right, with footprints.
Yep.
That will do things like labs and walk-ins and visits for cash. It won't take insurance, but it might be a really fair rate to go there. And why I bring that up is because this meeting isn't only about insurance. Again, insurance is the funding mechanism to pay for healthcare. But sometimes the price of healthcare in the system, the hospital system or clinic system, is too high priced. Would you agree with that? So, yeah, everyone's nodding. Okay? So, knowing there's some other options, whether it be neighborhood family clinics or Bronson community care clinics or footprints in time, where you can know the price up front before you actually consent to the thing you need done, is a pretty good option for you. So let me give you an example. How many here have had blood work done in the last year? Just, right? A pretty routine thing that they do during a preventative exam, okay? It's never preventative. It's always has a cost associated with it. And the hospital systems charge a pretty high rate for lab work, right? Matter of fact, it's usually the number 1 or number 2 highest profit center for a hospital. I myself am no longer really willing to pay the price that a hospital charges for lab work. I will always do my labs at a neighborhood family clinic or go to a footprints. Why? I don't care that doesn't apply towards my deductible. For me, it's a principle thing. And 2, I know that if Garrett, as a 35-year-old cancer survivor, whose dad's had 3 heart attacks under the age of 55, my doctor's probably going to routinely order based on family history and my history, lipid panel, triglycerides, cholesterol check, right? So if those aren't covered by your preventative visit and the hospital charges around $200 a piece for those tests, and I could get them for $20 or $30 each at a neighborhood family clinic or footprints, why do I care if it counts towards my insurance or not? I much always rather pay that lower amount, just pay for it with my flex spending account or credit card and be on my way. Here's the other nice thing. They can send your results to be a part of your medical record at the hospital system in which you're at. So here's one other thing that I do as a tip. When I'm going in for my preventative exam, which preventative exams on your Quartz health plan are covered at 100%, okay, for things that are preventative. The definition of preventative is you are being seen for, at your age, your gender, for non-known conditions. Okay, you have nothing, so I'm going to look at you. You're a 33-year-old male. How am I close?
That's really close.
Okay, 33-year-old male-ish. You go in, and if you go in for a preventative exam, and they're just seeing you as a 33-year-old male with no known conditions, once a year, preventative. But if you all of a sudden are a 33-year-old man that starts to bring up known conditions about my health, your health, and they want to run some additional tests, okay, the preventative visit becomes diagnostic for those known conditions, and the labs will have a cost to you. So they could charge, if all of a sudden you go, this mole I've had here changed colors over the last year or so, I just want you to look at it. They can now charge you a consultation fee for that visit if they so choose, okay? And program that in the computer that they're on during your visit and make sure it gets billed appropriately so that in a month or 2, when you get the envelope from the hospital, it's run through its insurance, you will see a cost on there. So what I've tried to figure out is, what are the things that are going to have a cost to me, and what are the things that are not going to have a cost to me that I can do that are covered underneath at least my preventative exam. One of those things I know that's not going to be covered is labs. I will always do my labs a week or 2 ahead of time before I go in for my preventative visit. Okay, I will send them to my doctor. They become part of my medical record, and they'll actually have the results there for my preventative exam, so he can actually see what my blood work is during the visit while I'm there. To me, the system's kind of backwards. They always want you to do labs during either that same day or come in before it and then have that additional cost. if you do it at a cash clinic, you could send them over there and then have them know what they're looking at while they're on that visit. Okay? And then labs is just an example. It could be just going in for an office visit, right, for a common ailment. You just want to be seen face to face. These cash clinics can do a lot of different things, and I want you to check out their website so you can see their full menu on what they're able to do. Neighborhood Family Clinic has a dermatologist on their staff. For $89, you can get in within a week and see a dermatologist. Guess what? Dermatology is not $89 inside a hospital system. Most of you aren't hitting your deductible in any given year either. So knowing how to doctor smart is a really good step. Okay? I could go all day on this stuff, but I'm gonna keep moving because we have to, okay?
I got one quick question. Is
Yeah.
there a list that says what's covered?
There is.
Free
On the wellness.
on the wellness check? 'Cause I have one coming up in the next month here, and
So all of your plans must cover preventative care that the Affordable Care Act lays out as a list of things for men, women, and children that are considered preventative, okay? So you go in, right, there's a whole list. So let's say, right, for adults, we know at age 50, we get the extra bonus of a colonoscopy. That's considered preventative every 5 years, right? But if all of a sudden you have one of them and they find something during it, that colonoscopy will no longer be preventative because of known conditions. So it's a little different, what I'm getting at, it's a little different for everybody, but yes, there is a set list of things that are covered as preventative. Quartz prints that out, and we have a flyer on that that's out in your electronic library, okay, or Victoria will make sure that it's out there, and you'll be able to go and see that whole list. Yeah, I think it's like 80 some things.
You gotta tell them
well,
up
I'm
here.
assuming you don't have a list here then, that we can
We
take
will.
with us right now.
I'm good, but I'm not that good. I gave you it electronically. Everything you have now is in a, you just go out to your Jackson County website, because every single person of the 300 and some enrolled here wants a different thing from us, okay? So if you wanna see me after, we could get your email and send it right to you to appease you. So these are the items, that I wanted to address on cash clinics. West Salem, as of January, is opening one as well. Sensible Health Clinic is opening in West Salem. It's gonna house a neighborhood family clinic, as well as a MRI clinic called Smart Choice MRI for lower cost MRIs, and also a cardiology team that can do stress tests and echocardiograms. Having competition that can do things within communities is a good thing. I hope you all agree with that. Sometimes insurance doesn't cover it, but that's okay, in my opinion. As long as you get to a lowest net cost for that thing you want, it's important. Yes?
On those wellness physicals, I was told up here at Black River that, cause I got billed for some that I didn't expect, like everybody did when the everything came.
Yep.
They said, oh, you have to tell the doctor so it's coded right.
Yeah,
That
wrong
makes sense?
answer out of them. It's a very lazy answer out of them, right? They're expecting you to be a healthcare expert.
Yeah.
No- nobody in this room is a healthcare expert.
Blind or something that don't
Here's
matter.
here's the one thing that I do. Here's the one thing that I do, so everyone hears this. When I'm going in for my preventative exam and you wanna make sure that it stays preventative, I say this to my nurse and my doctor. I say, I'm here for my preventative exam. Why I'm telling you that is my one time where my insurance covers this visit at no cost to me. What I'm asking is that if there's anything else that we talk about today, or that he or she wants to test, that's gonna have a cost to me, I would like to know what that is, and I'd like to consent to it. If you say that front talk, you will have the ability to know it, or let them find the answer to what that thing is that's gonna have a cost. And lastly, if all of a sudden you've said that to the nurse and the doctor, and all of a sudden there's a bill that shows up anyway a month later or 2 months later, okay, you can dispute that. Because every once in a while, they don't know if it's gonna have a cost to you.
Well, they don't care either.
Some of them don't care,
They don't care.
okay? But the reality is they need to start caring, because things have a bigger price tag these days than they once did in the system. But they do see different patients, right? They see Medicare patients that pay a different amount than you all as privately insured, right? You pay a higher cost for care than some people out there. And they don't know where you're at in your insurance, they don't know where you're at in your deductible. All you wanna know is it coded preventative or not? And if you're recommending or you're gonna charge me for something, I want to consent to it first. Does that help?
Mm-hmm.
So just have that conversation when you go in.
That's what I did this time. I said, you know, that I,
Talk to you before they,
yeah.
good, that's great. All right, to keep moving, The last thing I want to cover on the medical plan before switching gears and finishing up here is the prescription drugs. So you have the prescription drug co-pays, and you have some different tiers with quartz. Here's how this works. Like a preventative visit, meaning preventative's covered at 100%, there is actually a list of preventative drugs with quartz as well that have no cost to you. Okay? So you can
I
have
don't know.
those drugs at zero cost, okay? Or there's some other maintenance medications that you can get called their value tier for $5. So there are certain drugs that Quartz wants you to be on that will only cost you $5, right? Because you're cheaper to be on a $5 medication from them than having something major happen. And then after that, you have different tiers for the drugs you're on. So tier 1 is generic drugs, the $10 generic drug list, okay? So most of us here at Jackson County are on generic drugs. Matter of fact, about 92% are on them. Okay, so you're gonna have a 30-day supply for $10, all right? Try to get on 90-day supplies if you can. It's always a little cheaper for you. Tier 2 and Tier 3 are brand name drugs. Okay, the difference really between them is where they sit on the list, but they'll be either a $35 copay or a $50 copay depending on the name of the drug. And then worst case scenario, you have a $200 copay that would apply towards your out-of-pocket maximum for specialty drugs. Now, specialty drugs prices are all over the board. Some are as high as $5,000 to $10,000 a month that we do pay for at Jackson County. Okay, but obviously you're capped at your out-of-pocket maximum at $1,500 because of the HRA for any individual. All right, prescription drugs is a pretty wild game right now. Okay, there's a lot of funny business that's going on with prescription drugs, so I have a few pointers on that as well. Inside your guide on page 11, I put in a brochure just all about prescription drugs and a savings tip guide. You have the ability to have an app on your phone to always check the true cost of a drug and its cash price at any time using GoodRx. Okay, so GoodRx.com is a website and it's an app that I can check to see what the cost of the drug would be if I bought it without using insurance. Okay, and the reason I'm spending any time on this, even though you have co-pays and fair co-pays on your health plan, is it's good to know that sometimes the drug that you might want might be cheaper to not use your insurance than to use it, right? So all of you know sometimes Walmart has a $4 drug list, right? So why pay 10 if you can pay 4? Other times, what I want you to understand is sometimes retail pharmacies charge way more for a certain drug because it's the most frequently given dosage amount, and they know that. So guess what dosage amount they charge the most for? The one that's most frequently given. So I'm just going to give you one example of why I think this is important. So if you were on a 6-month supply of a generic drug, how much would it cost you? This is the interactive part.
$60.
$60. $10, 6 times a month, right? So why I use this is if I'm in the doctor's office and they're going to prescribe me a new medicine, and they go, where do you want it sent? I can actually look up the drug right there on the spot, know the cash price, and I can always ask my pharmacy what's the cash price versus what's my price if I use my Quartz copay card, right? I'm going to give you an example. Atorvastatin, the generic form of Lipitor, most commonly given as a 40 milligram tablet. Okay? If I get a 3-month supply of atorvastatin through the plan, it's $30. Okay? I know I can buy that drug cash at Walmart 0.6 miles from here. What's the cost on atorvastatin for a 3-month supply?
$38.
You gotta say it loud.
$38.
There you go. And you're being recorded. $38. Okay? Atorvastatin, though, is a tablet. I can actually see a picture of the drug on here if I click on it, and it will show me that it's a tablet. And the one thing about tablets is that you can split them. And right on this website it says splitting a higher dose pill can sometimes save you 50% or more. And because I know pharmacies charge the most for 40 milligrams, because that's the most commonly prescribed medication, if I go in here and edit the dosage amount to see the price on an 80 milligram prescription, hit save, and rerun it for the same price at Walmart, and if I ask my doctor that I want an 80 milligram prescription of it because I'm going to split the pill myself with a fancy pill splitter called, it's basically a razor blade for 80 cents, and I can get twice the supply on a one prescription, what's the cost at Walmart for a 3-month supply of 80 milligrams?
$31.94.
So it's $31.94. So it's $7 cheaper to get twice the supply if I just split the tablet myself. That's how complicated healthcare's gotten and pharma's gotten, where they charge differently based on what they know. Why I also show you that tool is just to make you a better consumer of healthcare. And sometimes you have friends and family that are not on as benefit-rich plan as Jackson County has, okay? Or they don't have insurance or prescription benefits that are this good. So they really want to shop around the different pharmacies and know the different prices. I know in La Crosse, when I search that same drug, it's anywhere from $22 to $127 depending on the pharmacy I go to. Okay? Now, if you don't use it, status quo, but you just said it was $60 if you just do the routine thing, and I know I can get it now for $31 if I just pay cash and don't even use my copays.
Mine was Cinepro, used to be for 90 days, used to be $2.90, and then we went to quartz, now they charge me $6 and something up here for it.
There's lots of
I
different
thought,
examples for every
wow.
pill out there.
It's the same pill in the thing.
That's right. So I wanted to point it
How much
out,
did you buy
there's your
it?
flyer on it to share.
Mine has $2.50.
The other, my last little joke is, some of you guys have pets? You got a pet? Ever seen what vets charge for prescriptions?
Oh, yeah.
GoodRx has a pet division too, just so you know.
Oh, is it?
Okay. All right. Last couple things that I want to hit on about Quartz before switching gears and wrapping up. Quartz also has some built-in value-added pieces to your plan. This isn't in your guide. Okay. Quartzwell, right, was introduced last year. This is kind of their rewards program for people that go out there and do some certain things. They get points, and for every 1,000 points you get a $25 Amazon gift card code on your MyChart portal. How many here have Quartz MyChart portal set up? Okay, about 25% of the room. Remember, MyChart is your access to all things insurance related. You get copies of your EOBs, your claims, and your own ID cards. Go out there and create that if you want to. Okay. And the other reason you want to is that's how you access Quartzwell. It has 4 categories: engagement, fitness, prevention, health, and well-being. You get points in different buckets, and every 1,000 you get a $25 Amazon gift card. You can get up to $100 back for you and $100 back for your spouse if you do this.
Now, most doctor at the Crown Clinic, now, is that just you have to doctor?
So if you want points automatically applied to your Quartzwell plan, and you doctor inside the network with Quartz, they will put those points out there for you. Okay? So some of you, if you go out and create your MyChart portal right now, you have points out there for just doing your preventative care. Because you get 750 points for just doing a preventative exam. Okay? You get 500 points for a flu shot, 200 for a vision exam, on down. Prevention visits that are in network will be out there already preloaded for you. Now, you have to do something for the health and well-being, fitness, and engagement ones to get those points added in there. But we just wanted to make sure that you knew that it's available to you. If you sync a device, so Fitbit or you keep some kind of app on your steps, or you have an Apple Watch or any of that stuff, you get 2,000 points a year or $50 in Amazon gift cards. I always tease people that certain versions of Fitbits now are like $80. If you just buy one, you sync it one time to Quartz, you get 50 back from them, so you get a $30 Fitbit. You do it again next year, now it's free, and then if you give it to your wife as a Christmas present, they're paying for the never mind. Okay, so just know that there's options available for you to do different things and get different points. Inside the MyChart portal, when you go into Quartzwell, this is what your screen will look like. It will put these codes out here. That is your $25 gift code out there. You want to copy and paste that out of Quartzwell and into your Amazon account to use it by December 31st. This reloads every year, so those codes disappear if you don't get it out by the ball dropping on Christmas Eve or New Year's Eve. Okay? For those of you in the room that don't have an Amazon account, look to the person to your left and right. They do. They will take your code, right, and use it. There's also ways out here to do different things to get points as well. So you can have a health risk assessment. You do a 10-minute risk assessment for 400 points. And again, this is for both husband and wife on the plan. Okay? So use Quartzwell. All right, and the last thing I want to hit on, medical related, is page 14. flex spending accounts. We put a page in here all about flex spending accounts because we want to make sure that you are avoiding tax where you can on known expenses for medical, dental, and vision that you're going to have throughout the year, or unknown for that matter that pop up. In 2020, you have the ability, okay, to put up to $25.50 into this account. Kyle, are we raising that to now the new limit? Staying at $25.50, okay. So $25.50, the same amount as the previous year. You can elect to put up to that number in there to pay for medical, dental, and vision expenses pre-tax. So for most of us in this room, we would save federal, state, and FICA tax, which equates to about 25% of our paycheck. Sorry for that reminder, right? Uncle Sam takes about a quarter of your paycheck when you work. If you put that money into an FSA first, Uncle Sam does not take that money, and then when you use it on medical, dental, and vision, obviously it's tax-free. So the nice thing about your plan is it does allow for you to have a rollover each year of up to $500. So for some of us, we know a couple rules about flex spending accounts. Rule number 1, if you don't use it, you lose it. There's truth to that, but only if you have more than $501 left in that account at the end of the year. The first $500 that's left in there, okay, will roll over to the next calendar year. So what you want to do is you do want to spend your account down to at least $500, but you can feel comfortable putting at least $500 into it throughout the entire year of 2020. So we get paid bi-weekly here at Jackson County, right? I'm being told 2020 has 27 pay periods, but let's just go with 26 because that's what we all know. If I were to elect $1,000 to go into my FSA, because I know I'm going to have some teeth cleaning or some vision, dental, and a little bit of medical, I'm going to divide 1,000 by 26 pay periods. 24. Oh, semi-monthly. Sorry, 24 pay periods. Okay, and that's the amount per paycheck that's going to get put into my FSA. A positive with FSAs though is that even though I'm only going to put in that equals payment up to $1,000 over the whole year, 24 times, I have access to the full balance of $1,000 from day one. So let's say you got a kid that's going to have braces payments due, and you want to write a check for $2,500. You could do that on January 2nd, but then pay that $25 into that account over the whole course of the year and spread out your cash flow. That's a positive for flex spending accounts. The negative, if you put in $2,500 and you got to start spending money on unnecessary things at the end of the year because you got to get down to that $500 threshold. Okay, there's no changes to that. I'm just making sure you understand it. And lastly, the good thing about that too is most of us should then be putting in $500 because that amount rolls over every year, and you can avoid tax on at least $500. Dependent care, so that's medical FSA. There's also a dependent care FSA where you can put up to $5,000 for daycare expenses into those accounts. And there's an example on that sheet of if you do that and you avoid tax on $5,000, it pretty much equates out to about $1,300 in tax savings. So real money. So there's an election form and a process to do so. Kyle has the FSA forms. I think we have them in the back right now.
Well, I don't know if those are back.
Or we'll get, if you want to change your election or make your election, you can do so by grabbing it. Victoria put them back there, I believe. Okay. Any other questions on the medical? All right. Last couple things. Financial wellness. We roll out those all-state benefits to you all in the past. Just as a reminder, if you do what we say, these help pretty much pay for themselves. Okay. Allstate's program that we have offered to you all is cash benefits direct to you, tax-free, that helps you offset medical expenses like your deductible, your co-insurance, time away from work, in the event that you have physical injuries to you, your spouse, your kids, or sickness or diseases to you yourself or your kids throughout the year. The nice thing with these plans, it covers kids age 26, and what they do is they allow for you to not have financial distraction or dip into savings to pay for things because they're going to be covered by Allstate. Said differently, some people go, why do I need insurance for my insurance? Because this picture shows you in here is Uncle Sam's going to take his 25, 28%. You go home and spend and save with 72% of what you make. If it happens to you where disability covers it, okay, disability does not cover spouse and kids. You're gonna get 60% roughly back of what your disability is. But you still have then your deductibles, your co-insurance, all those other expenses, so your take-home pay keeps getting reduced by new expenses. This is to help offset those new expenses, okay? And get you back to roughly whole. The other nice thing about this plan when we rolled it out for you is that you can take it with you the day you no longer work here. This plan is completely portable at no additional rate increase and with the same benefits the day you no longer work for Jackson County. That's huge, okay? That first program, the accident plan, on page 17 and 18, covers physical injuries that have a time and place for you and your family, okay? You slip on the ice some night here in December, you have to go into a visit at the clinic, okay? You're gonna have coverage on this plan for those things and all the different combination of the types of options you have available to you. We do offer 2 different plans on the accident plan, okay? And we'll pay you then according to those buckets of money that is listed in here. And you will see in this example down here of someone who's on plan 2 that everything that you are seeing for compounds and pays you a total tax-free lump sum for those types of injuries. That's your money to spend however you want. You do not need to be on the Jackson County medical plan to have this, by the way. Okay? You can buy just this if you want. The other nice thing about the accident plans is it pays for things other than just accidents. So on page 17, this blue box, it explains how we have an outpatient physician's treatment rider. It's basically a benefit on top of the benefit that says, if you just do some preventative care, Allstate's also going to pay you some money for taking care of yourself. Some of you know this, and some of you are doing it, but depending on which plan you're on, you either get $75 or $100 a couple times a year when you do that. So if you go and see and have your preventative visit, you go get your teeth cleaned with the dentist, you have an eye exam, a hearing test, any of those things, and you submit them to Allstate, 2 times for you, and an additional 2 for family members if they're on the plan, you're going to get anywhere up to $400 back depending on the plan you're on. Why that's nice is regardless if you have accidents or not, you get the accident coverage, but then you flip to page 19, the pricing on how this works, okay, is you have your premium depending on the plan you take and who you cover in your family. It comes out pre-tax out of your paycheck, so this second column after the premium column is the net cost premium to you because you're not paying tax on it. So if I were looking at taking family coverage on plan 2, because it has higher benefits, my net annual cost is $404.88. Everyone see that? If I submit 4 wellness visits, I get $400 back. And I have all the accident coverage then for literally $4.88 a year. Or 20 cents a paycheck. The catch, because some people are going, well, what's the catch to Allstate? The catch is you have to submit your claims to get that money. You have to do something to get it back. And what we do is, in the back, on the back table back there, we have a whole list of how to file claims and teach you how to do that electronically via your phone. So you can use your camera on your phone to do that. Or you can do it paper copy. Okay, where you just submit a form, attach the proof that you have that visit, and they'll send you your money. How many in here have done that on these plans? A couple of you? Easy for the most part? You've been doing it every year? Okay. The other nice thing is there's no expiration date on them. So if you buy this, okay, you can submit and get that money at any time you forget. Okay? You have to submit them within 12 months to do it electronically, but you could always do a paper filing if you forgot and it's 4 years later. And I'm talking to the men in the room who are very not good at filing claims, right? That eventually if you get to it, you'll be able to get your money on this plan.
So you did say if we do it electronically, it only goes back 12 months, because I'm doing that right now with
Yep.
18-month-old claim on
You have to do the
physical therapy that I should get money back.
Yep, you just have to do the paper claim
Paper
form.
file.
Yep.
Okay.
And if you ever have questions with that, you can always call Victoria or anyone on our team, and we kind of navigate that so you don't get stuck in the weeds on certain rules there. That's what our team's for as well.
Reading through it the other night, it said 12 months, I thought it was
Yep.
dead in water.
Nope.
It can be a paper.
You can go back with paper copy. So we have those instructions in the back. I do mine on my phone. I get my teeth cleaned twice a year because it's covered by my dental plan. I get the sheet from the counter when I leave the dentist. I take a picture of it with my phone. I upload it from my camera roll, and I just do the filing right there on the spot. It takes me 2 minutes. And I have direct deposit set up so the money goes right into my checking account. Okay? If you want help getting that set up, we can help you too. The last two plans are the cancer plan and the critical illness plan. These are the majors, right? No one wants to go through this experience, but guess what? Cancer doesn't discriminate. Okay? So if you look at these plans, you actually have 3 offerings on the cancer plan. Plan 1, 2, and 3. Okay, I'm a big proponent of plan 2. I'll just tell you that. Plan 2, in this second bucket of money here for radiation and chemo, gives up to $10,000, and that reloads every 12 months. Here's the thing about cancer. It doesn't start and end within your plan year, typically. So when things happen like this, where all of a sudden you might be doing treatment for a while, you could have 2 deductible years happening, or 3. These benefits recharge and also give you those big buckets of money each time that they happen too. There's also huge benefits in here for 29 other diseases that we list out. Even though it's the cancer plan, most people forget we cover 29 other diseases on this plan too. Okay, I'm flying through this a little bit because it's recap. If you haven't had it, this is your one time a year where you could add these plans too. We have forms in the back where you can literally just fill them out and get on these plans, okay, if you want them. Yes, sir?
You said plan 2 is the only one that
No, you could get on any of the 3. I'm a fan of plan 2 because of the dollar amount in there. And the reason is some of the cost, the time away from work, and all those other things. I also say that, which I skipped over, is someday you're not going to be on as rich of a medical plan as Jackson County's is. Reality, you might not work here in the future, or you might be on Medicare. And $5,000, which is plan 1, $5,000 10 or 20 years from now is not going to feel like $5,000 anymore. So I kind of look at a plan that I could take with me, pay the same premium on. It's going to have value to me when I no longer work at the place I'm working at. Okay? Because a lot of people like to take these into their retirement with them. They're a good supplement to have. And frankly, right, we all know this, cancer is more likely to happen the older that you get. So, all right, so that's a little bit of the cancer plan. Also remember, you get one more wellness benefit for $100 if you do any kind of wellness screening or test that's listed on this policy. So if you do have one of those blood tests that I talked about, okay, or you go down to Footprints, pay $20 or $30 for doing one of those blood tests, you get $100 back for your Allstate plan for even doing it. Okay, so the cancer plan pays you $100 and everyone in your family $100 if it's a test. The accident plan pays those dollars if it's a visit. That's the difference. So the question that some of you go is, well, what if I do a test during a visit? Good question. You can double file that, one on the accident plan and one on the cancer plan, and get paid twice for the same visit. Okay, I don't expect you to remember all this, okay? Just know you got help with our team to help you get through it, all right? And lastly, the critical illness piece on the Allstate, page 23, is lump sum benefits to you. You have 2 options, a $10,000 option and a $20,000 option. It pays for things like heart attack, stroke, these other major items listed on here. Your rates are locked in when you buy them. They do not change. And what you'll see on here is the cost to add kids and or family doesn't double or triple the cost. It goes up just very little. Your dependents get half of the benefit that you get. Okay? So $5,000 or $10,000. And this plan's a good one to take with you as well. So lastly, on page 24, we just put an example in here of someone who took all 3 plans on the low options and what the total net cost is per paycheck if you were to have all 3. You submitted those claims. Okay, so it's just an example we wanted to include for you. And last thing I'm hitting on, I'm done. Okay, page 25 is your dental insurance summary. Your dental plans with principal. Okay, as a reminder, this is your cost on the bottom of this page per month. It's your per monthly cost, not your per paycheck cost. Preventative screenings are covered at 80% by your dental plan. You pay 20%, and you have a $25 deductible one time for an individual, up to 3 of those per family, and you get a $500 a year benefit to go towards these items. If you have basic services, it's 80% as well. Major services, principal pays 50%, you pay 50% up to that $500 maximum. Orthodontia, kids do get a $1,000 benefit once per lifetime on this plan. Okay. In the packet, the remaining sheets in here Page 26 through 29 are government notices to help you sleep at night, okay, if you want to read those. Page 30 is your contact team at our offices.
$4 a day.
You have a checklist that got inserted into all of your packets. The nice thing with your benefits, if you're not making any changes, you don't have to do anything but turn this one sheet in. But if you want to enroll in the Allstate, or change your Allstate enrollment from Plan 1 to Plan 2, or you want to change who's on your health plan, you would check change coverage, and you would grab the appropriate form at the back of the room, or get that form from us at a later time. Kyle, you want these back when?
November 26th, I guess.
26th of November, okay? And the appropriate forms if you're making changes. Okay, everyone take a deep breath. That was a lot of information in an hour. And we started exactly an hour ago. Feels like we've been here for 3, does everyone agree? What we want you to understand is this is meant to just be a guide throughout the year to help you and help navigate it for your families. Our contact team at the Insurance Center can help out throughout the year. Susie's great in your HR department. Kyle and her team are great on helping navigate this. But you are not healthcare experts. And unfortunately, the system wants you to pretend to be one once in a while. So please lean on the appropriate help. If you have individual questions after this meeting, you want to ask Victoria, myself, and Kyle about, hang out for a few minutes, and we'll go from there, okay? Thank you for your attention. See you later.